All right, so good evening, everyone. It is really nice to have you all here, and nice to virtually meet all of you. And I hope, as if you are receiving services here, I do look forward to getting to know you as well. The title for our lecture today or this evening is called Changing Your Dusk to Dawn, Finding the Steps Forward with a New Cancer Diagnosis. Now, as Jess very graciously introduced us, as you notice, we are not medical. We're not doctors, we're not nurses. And our responsibility today is not to talk about your particular diagnoses or to talk about specific medical conditions. We are the part that is more practical. So the things of your mental health care, especially with Allison, with your financial care, that's what we're here for. So as you kind of go through, I'm sure you'll have some questions. So please, as just mentioned before, please, put that in the chat or hold it to the end. And if we can't get to you for today for whatever reason, you will have our identifying information, our phone numbers, email at the end. We'll be happy to connect with you. All right. So with that in mind, let's get started. As you guys could, let's see. Here we go. What does this look like to you? I think some of you guys will see this as a sunrise, perhaps, or maybe even a sunset. But how can you really tell, right? And especially, and that's something that, that's what's called twilight a lot of times, right? Twilight is a soft glowing light from the sky when the sun is below the horizon. Now, did the sun just go down and you see that hazy dark, or is it just about to come up and light is about to come? We're not quite sure. So when it comes down to a moment in time, that perspective really depends on how you see it. So, especially as you or your loved one is going through and facing a new cancer diagnosis, the question to ask is this your dusk or is this your dawn? Now, dusk is when a moment before sunset fades and the darkness appears. It's usually associated with sadness or severity. Dawn is that moment before night fades and first light appears. It's associated with calmness and hope. And I know you feel, again, when you face, and your family faces, when your friend faces this cancer diagnosis, it feels like you're in that twilight moment when you see everything and you see nothing at the same time. And what we want to impress upon you today and give you the information so that for you to recognize that at this moment of twilight, your decision of how you will engage with this unknown road ahead will determine its impact on you. Your choice leads to your perspective. So to kind of frame our conversation today, I want to introduce you to a story in Greek mythology. Some of you guys might be aware of Odysseus and the Sirens. It is one of Homer's epic poems about Odysseus, the hero, and his journey home from Troy. Now, one of the first dangers he faces as he goes back home or tries to go back home is as he is in a ship sailing back, he encounters the Sirens. They are beautiful but dangerous creatures that sing this alluring song, and they seduce anyone who hears that to their death. So the story is that Odysseus, he wanted to hear the siren song so badly that what he does is he puts beeswax in his men's ear, and he had his men tie him to the mast of the ship, because Odysseus knew as he got towards the area where the sirens were, he would likely jump out the ship and swim to his death. So here's the interesting thing though, before Odysseus put the beeswax in the men's ears, he told them specifically, he instructed them, from this point on, do not listen to me, no matter what he said. So the men put the beeswax in their ear. They started rowing towards the sirens to go through them. And Odysseus, as he's traveling, he sees the sirens and he begins to hear their song. And Odysseus begins to lose his mind. And he says to his men, let me go. And of course, the men in the beeswax, they can't hear him and they're not going to listen to him because Odysseus specifically told them to not listen during this time. And Odysseus gets more angry and more frustrated. He says, as your king, by the order of your king, let me go. And still, the men did not. Even though during that time, if you disobeyed the order of the king, it was certain death. And that was the way Odysseus and his crew were able to get away from the siren song, from the sirens in one piece. Now, the reason why I tell this story is that I think there's some couple of parallels and couple of takeaways that we can hold for our time together today. And the three main things are, for one, Odysseus had a knowledge to make the plan. He had knowledge. He knew what he was going to face. And then with that knowledge, two, he made a specific plan. And he made that plan not during the turmoil, not during when he was literally losing his mind, but he made that plan beforehand. And third, if not most important, he had people to help him. He had people to help him, and he gave them particular directions to do specific things in specific times. And with all those three things put together, they were all able to get through a certain danger and on to the next part of their journey. So we want to make sure, first of all, your knowledge drives your choice. Commonly in therapy, we talk about, the idea of a counselor, of a therapist, is not to give you the answers. We're not a magic 8-ball. You don't want to, ask us to, how to raise your kids per se. But we say as therapists that, we're more like a mirror. We give you different perspectives on what you're going through. And by that knowledge of those different perspectives, we hope that you will make the choice that is best for you. Knowledge is extremely important, especially as you're going to an uncertain situation. Your knowledge drives your choice. So with that in mind, we want to cover these three main topics today. So what am I facing? Generally, what is this cancer, and what does that entail? And two, who can help me? Who is in my multidisciplinary team? Who can I reach out to for what particular needs? And then three, with all those things considered, what is something that I can do? What we will cover is the practical guide to partner with your medical team so that you, your loved one, could all go through and get to the other side. So with that in mind, let's begin. So what am I facing? This is just a general overview of what cancer is. Cancer is it's a collection of related diseases in which the body cells begin to divide without stopping and spread into surrounding tissues. Now, people think cancer and they think it's the C word. They think that cancer equals death, and that is very far from the case. Cancer in itself, like it says on the screen, is a collection of related diseases. There's actually over 100 types, right? And what cancer does is it impacts the cell's quote unquote circle of life, right? Every cell in the body, they have a particular function. They grow, they perform their function, and then they break down, and then new cells that do the same thing grow and take over, and that cycle goes on and on and on. However, as the cancer cells grow out of control, they break down that loop. They break down that cycle. It damages the cells it damages the cells so that it survives when it's supposed to not be there, right? So as the cancer cells grow out of control, they can crowd out normal cells. This makes it hard for your body to work the way it should, because everything is all connected together. But when one part begins to not function as they're supposed to, then things go out of whack, right? So these extra cells that keep dividing without stopping, even though they're supposed to end their cycle of life, that growth is generally what's called a tumor. And in regards to the different types, as we said, there's over 100. There's two major categories of cancer. The hematologic cancer, which is the blood cancer, right? The cancer of the blood cells, which includes leukemia, lymphoma, and multiple myeloma. And then you have the ones that people are more familiar with, the solid tumor cancers found in different body organs and tissues. So when someone is facing cancer, there are different ways to treat cancer. And what I'm gonna do is just review give a very general overview of the different treatment options. First, you have your surgery. Surgery, as you may know colloquially, it is when you go in there and you take something out, right? So in terms for oncology purposes, they resect, which is to take out, and they also take out to biopsy, which is to sample that particular tissue to exactly know what kind of cancer it is, because that will also enable the doctors to figure out what to do to make sure they can complete that course of treatment. The next one is your chemotherapy, commonly known as chemo. They are powerful drugs to treat the cancer or to control its growth. Like cancer is an umbrella term, chemotherapy is a wide assortment of drugs that can be used to help you in your treatment. You receive your chemotherapy treatment through IV access, but it can even be oral, as in a pill, or even in some cases, topical. There's also radiation therapy. Radiation therapy can break down into two different types, the external beam and the internal. Radiation therapy is where your body encounters or gets faced with high energy particle waves to destroy and damage the cancer cells. And in particular, radiation helps to break the cancer cells from growing and dividing. The external beam is exactly how it sounds. You lie down on a table, and then there is the machine. It shoots down the beam outside of your body. And then internal therapy is when they actually, through surgical means, put small amounts of controlled radioactive material within your body to target the particular area where cancer is present. The next major type is immunotherapy. It's a form of biological therapy, and simply put, it boosts or reorients your immune system to fight the cancer. So whereas a lot of people put chemotherapy and immunotherapy under the same umbrella because it can be also given through IV means, but it performs a different function, that it works with your body and your body's immune system. Next, you have your hormone therapy, commonly in prostate and breast cancers. It helps to treat cancer and ease cancer symptoms by blocking the body's ability to produce hormones or to interfere how hormones behave in your body. Now, all these different treatments, it could be used, it's not in this particular order that the treatment is done. It is a mix and match, and it all depends on your situation or your family member situation. They may do surgery and then do radiation, or do a therapy first, chemotherapy first, or radiation first to shrink the tumor. All of that depends on your cancer, how far it has developed, and where it has grown. Your overall health. There's many different factors, but these are kind of the general tools that the doctors will have to help fight your cancer. So a lot of treatments, it sounds very complicated. That's why we have a team. And this is just a small part of our team. Your multidisciplinary team here at Capitol Health consists of many, many different people. Especially administration, doctors, nurses, clinical staff, supportive services. And I really like to say, even from the get-go, it really starts with administration. And someone as a supportive staff member here, I've noticed how our administration is so supportive of our patients by providing such really, I want to say detailed, but also just caring support. They allow the multidisciplinary team here to provide comprehensive care in regards to the technology, hiring the right and really some amazing specialists and some really bright staff. So we all in conjunction, we work together to fight for you. The multidisciplinary team each part of the cancer center, there are different programs, as you can see on the screen, from bone, breast, colorectal, gynecology, lung, neuroneurology. As we said, cancer is an umbrella term to describe many different types of diseases. And the Cancer Center here, we cover all the major parts with multidisciplinary teams and programs for each major disease site. And in each team, there are multiple factors from doctors, nurses, navigators, social workers, dietitians, therapists. But as you notice in the screen, the biggest part and the most important is you. You are the one that drives this treatment, meaning we will do we will comply and we will do your wishes. What do you want in your treatment? What is your goal? What does it mean to come to the other side for you? And that is the mandate that we follow. We do anything and everything to make sure that you can focus on your treatment and what is important in your life. We listen to hear about your goals and to work with you each step of the way. So let's kind of just go through the breakdown of the team, in particular doctors. I mentioned before there were so many different forms of treatment. Well, each of them are very specialized, and there is a doctor for each one of them. And especially when you or your loved one come in for treatment, there are so many doctors to see and so many names, but they all perform a function and they all work together to make sure that that your outcome is optimal and best as possible. It starts with the oncology surgeons. They are the ones that perform the biopsy, the resection, the medical oncologist, what people commonly call chemo docs, but they are the ones that really are kind of the front line in taking care of your oncology issue. You have your radiation oncologists. Those are the ones that specialize in the radiation therapy. Then the radiologists are the ones that read your scans. You will go through various scans for the doctors to see how you are progressing in your treatment, and the radiologists are the ones who make sure and read those scans properly. You have your pathologists who through the lab identify what kind of cancer it is, the staging in terms of how much it's grown, or where other parts, if it has spread or not, so on and so forth. On top of that, you have your specialists, depending on which part of the body the cancer is in, and then of course your primary doctor as well. So they all work together in one unit to give you the care that you need. Now, from the doctors, you also have your nurses. I think nurses, if we could use, if I could use the metaphor of a multidisciplinary team as a meal, the doctors are the chefs, but the nurses are the servers. They're the ones that know the ingredients. They're the ones that get to know you. They're the ones that will bring you the meal. They're the ones that will take care of you throughout. You have your advanced practice nurses who work in close conjunction with the surgeons and the doctors. You have your clinical care nurses who will see you in the office and assist the doctor, whatever care that you may need for that day. And then in particular, for our purposes, because Allison and myself, we are in the supportive staff, I just want to give a big highlight to the nurse navigators. And particularly, even this topic is about how do you really navigate through this new diagnosis. Well, if I had to break down this hour seminar into 2 words, it would be nurse navigator. They are the point of contact for you, for whether for each program that we have for each part of the body for the cancer, there is a specific nurse navigator. They're specialized in that part, in that care, and they are the ones that will translate. They're the ones that will listen. They're the ones that will help guide you through with all these different scans that may come up, or what does this diagnosis mean? What in the world is the staging? What are all these treatment options? Nurse navigator. Okay, so if there's anything you got to take away from this, remember those 2 words. Your nurse navigator. When you meet with a doctor and you speak with them, you'll be introduced to your nurse navigator. Get to know them. They are, I can just at least say, as I'm fortunate to be their colleagues, and they're some of the most wonderful people that I know. So please, if there's any two words you remember today, nurse navigator, they will navigate you through. They will navigate you through. Okay, now moving on. I kind of put clinical staff as a bit of a miscellaneous item because there's so many people under that umbrella. You have your radiation therapists. They're the ones that actually provide the therapy that will bring you into therapy in terms of the radiation. They will bring you into the room and then help you place you on the table and then execute the therapy that the doctors want. But even in the radiation, there's such a big planning process. So it's not just the doctors planning it, they're working in conjunction with someone called the physicist and the dosimetrist. Long story short, the radiation oncologist, the doctor that takes care of your radiation therapy has a big team to make sure to pinpoint your care for the radiation therapy. Then of course, in the course of your cancer, depending on the situation and even your social and life situation before, sometimes physical mobility can be an issue. Depending on the cancer site, even something as speaking and swallowing can be an issue. We have rehab therapists, physical therapists, occupational therapists, and speech within our system that work closely with us to make sure that you get the support that you need. Now, supportive services, this is where Allison and I are. It consists of the oncology social worker, the registered dietitian, the geneticist, the patient navigators, and the administrative assistants. As just mentioned, I primarily focus on the emotional support as well as the care coordination, particularly with the mental health portion. We have some fantastic registered dietitians. They all both have their certification in oncology, and in particularly with the different symptoms and side effects you may encounter with your diagnosis and treatment. They will provide really practical ways to help minimize those symptoms. Geneticists in particular is really good to meet with, and your doctor will speak to you more about that, in that it'll help you see, okay, is this something that is in my family line, is something that I need to know, and is there something that I could tell my family members about? It really helps to, again, have more knowledge of what you're facing. Patient navigators are similar to nurse navigators, but they will be the ones that will be holding your hand. Patient navigators do, as Allison, the financial portion, the transport portion of your treatment. If you require any assistance in terms of getting to and from treatments, and you're not sure of, how you're going to pay for these treatments, that's what the patient navigators are there for. And then I also must say, we do have some really amazing administrative assistants. We are here and they are here to make sure that you're not just seen as a patient, but as a person. So we have a really well-rounded team. I went through a lot in a very short amount of time. And as you guys can see in the graphic in front of you, there's a big cancer treatment itself feels like this huge mosaic. But each of us, we play our part so that the best possible outcome happens based on personalized, evidence-based cancer treatment. So with that in mind, and just providing that general overview, I'm going to introduce Allison now, or just have her come, and she will focus more on the financial portion and explain what that entails. So Allison.
Thank you. All right. Hi, thank you, everyone. Thank you, Christian. That was fantastic. All right. So, financial toxicity. Well, we're going to start first. I am very grateful to be here with y'all tonight. I hope that I can give you some of my expertise on, when I meet with folks every day, the things that they're going through with a new cancer diagnosis, and hopefully to give you some peace of mind through your journey. Okay. Financial toxicity. These are problems the cancer patient has related to the cost of treatment, and it can affect their well-being. So this affects patients as a whole, not just the out-of-pocket costs, but other out-of-pocket costs that we don't always consider, things such as transportation, to and from treatments. Have a diagnosis where you're having to balance work and family and travel. That alone in itself can be a huge financial burden. Loss of work, less work, with the cancer diagnosis, maybe not feeling so well, unable to work a full pay and pay your bills. Our goal here is for you to get well and not to have this financial stress. And so that is why I'm here. Because with anything, a good foundation is key. So good health insurance. Adequate health insurance is the most effective way to reduce and minimize the financial burden during your cancer treatments. It is important to know your coverage before. Unfortunately, most folks do not understand their coverage prior to a diagnosis or getting really sick. Folks have their insurance, they just assume it covers everything, but you need to understand the specifics of your policy. Everybody has a different plan. You need to understand what is covered, your cost sharing responsibility, other out-of-pocket costs, and then, there's ways to optimize your insurance. We're going to get into that too. A couple of key insurance terms. These are things that, I have folks, like I said, I meet with every day. They're not sure what their premium means. They don't understand what the deductible is. So I'm just going to go through these briefly just to kind of give you a good explanation. So a premium, that is the amount that you're going to pay every month. That you'll pay, whether you use your insurance or not, you are going to pay this cost, whether it's $100 or $200. That is your obligation to your insurance company, so that they will in turn give you benefits. The deductible, that is the amount of money that your insurance requires you to pay before they do. Some deductibles are set for the benefits, maybe $500, $1,000. That would there be your responsibility to cover, and then your insurance would start paying on your bills. Copayment, that is a fixed dollar amount. So that would be something like a doctor's appointment or a specialist appointment, chemo doctor, those kind of things. But it's a fixed amount. Therapies, physical therapy, radiation therapy. Coinsurance, this is the percentage that your insurance pays. And then, of course, the patient has a responsibility as well. Most commonly, 80-20 is the percentage. Your insurance will pay 80%, and then you are left with that 20% balance. Next is the out-of-pocket max. This is my favorite number. This is a fixed dollar amount that it is the absolute most you will have to pay for medical expenses through the year. So I just want to get a little more into this because this is very important. This number is huge. What an out-of-pocket consists of here, your deductible, your copay, and your coinsurance. Once all of that, you add all those things up, that equals your out-of-pocket max. That is the worst case scenario for what you will pay out of pocket per your insurance plan. Once you do reach that maximum, your plan pays 100% for the remainder of the year. And most insurances, they're on a calendar year, so they're going to run from January 1st until December 31st. On January 1st, it resets. So you're back to the responsibility of meeting that deductible, and then the accumulations towards your out of pocket. Okay. All right. Explanation of benefits. It's a notice from your insurance company that a claim has been received. It is not a bill. Folks receive these in the mail. They see balances of, maybe $6,000, $7,000, and it's scary, especially, when you're dealing with your cancer diagnosis and now trying to put all these pieces together. Bills are coming from different providers. But really what this is, it's a list of services that your provider has done for you and the costs associated with it. It is important to make sure these match. Make sure that what your provider has done for you, that is what you are being billed for, and that they are paying their percentage. It's sometimes as simple as calling your insurance and just asking for the benefits for a specific, maybe a test or even treatments. Radiation, I call for the benefits, and I call for the benefits, and then so patients might receive a bill saying that, this is what your charge is going to be for radiation, over $100,000. It's scary. But in reality, the most you're going to pay, and this is the most important, is that out-of-pocket max number, worst case scenario. Okay. All right. So where do we get coverage from? Here in the United States, we have employer-based coverage. There is Medicaid, Medicare, and military benefits. And then private insurance companies as in the marketplace. Employer-based coverage is health insurance that is purchased by your employer for the employee. And you both share responsibility with those monthly premiums. Typically, the cost is less for an employee because of the employer, the more employees they have, the better discount they'll get in buying group insurance health plans. And they can offer you more for a better value. Medicaid, it's a program, it's been expanded in New Jersey and Pennsylvania. It's for the age, blind, and disabled. You have to be a citizen of the United States, a U.S. national, citizen, permanent resident, or legal alien in need of healthcare assistance. So if you're in a low income situation, this might be the best bet for you. Here are the income guidelines for, it's quite a busy table, but ultimately the family size of one is $1,482 is the maximum income monthly to be eligible for a family care policy. Medicare, there are entire courses on Medicare that are hours and hours long. It is a big topic. There's a lot to cover, so I'm going to try and keep this short. And let's see. So it is available to those that are 65 and older. If you are under 65 and have a disability, you may also be eligible for Medicare. It does operate on one of those 80-20. So a secondary is often needed for Medicare. They will pay 80%, leaving you that 20% balance, which can be very costly and can add up quite quickly. So it is always recommended if you are able to get a secondary, a supplemental, please do that. Medicare has 4 parts to it. Okay, part A is going to cover your inpatient, so any kind of surgeries you have that you're maybe staying overnight, skilled nursing, hospice, home health care, those kind of things. Part B is your doctor's visits, preventative services, screenings, testing, anything that might be an outpatient service is considered Part B. Part C, these are relatively new. These are Medicare Advantage plans. And what these are is they're insurance plans run by private companies. However, they follow Medicare guidelines. So it may be an Aetna or a Blue Cross providing the care. With these, the only thing to keep in mind is it's in network. All of these Medicare C plans, you've got to stay in the network, which means you maybe see a provider, everybody's in the same area, in the same group, in your network. Okay, as in with original Medicare, you can go anywhere. So that is a big difference. You have a lot more options. So if you need to go somewhere, another state even for services, Medicare can go with you anywhere in the United States. But Part C, like I said, it's done by private companies and it's more geographical. So it keeps you in a network and close together. Part D is your Medicare drug coverage. Right, extra help. I know we all need it. Medicare does have some savings. They have a savings program, MSP. They can help pay your premiums, deductibles, co-insurance, co-pays, and prescription costs. There are lower prescription cost programs that you may qualify where your Part D could be completely paid for. PACE is a program of all-inclusive care for the elderly. So this is a dual plan where a patient would have Medicare and Medicaid. And in that respect, everything is covered. Back to Medicare also, there is a state health insurance benefit program that helps with Medicare, and they offer classes here at Capitol Health, so they will help you if you're just new to Medicare, learning the enrollment process, and they're there to help you if you may be eligible for any of these savings programs or premium reductions. Okay, health insurance marketplace is the next way to obtain coverage. This out-of-pocket max is incorrect. It is $8,550 for the individual. So that is the worst case scenario. It's still a high number, and that's still a lot of money. But they have set a capitation on these marketplace plans at $8,100. So that is your worst case scenario in a marketplace plan. The good news is that, it's based on family size and income, and, you can get a lower monthly premium with tax credits and cost sharing subsidies that will help lower your out of pocket. Let's see. All right, and also, let's see. All right, so this slide looks a little messy, and I do apologize, but this is just a little guidance on how to choose your insurance. And it's just as simple as doing the math. Basic math. I don't like math, but this is easy, I promise you. What you're going to do is you take your monthly premium. Let me see if I can do this. Hang on. Take your monthly premium. I'm just going to try and use the laser pointer, guys. Hang on one second. Okay. Take your monthly premium and you add your out-of-pocket maximum, and that's going to give you your total plan cost. All right, so what I did is I just pulled apart 3 plans, and let's just say these are all the same plans, all the same benefits, but this is the breakdown. And it's important to look at the deductible. It's also, but anyway, the monthly premium, I just pulled this one out, was $173, and out of pocket would be $6,000. So you take your premium, multiply it, you're going to get $2,076, and add the out of pocket, totaling $8,076. This one down here is at $400, and that is a high out-of-pocket monthly, you know, to pay for your premium. That's just to have the coverage. However, the out-of-pocket max on this plan is $1,150. So ultimately, plan 3 would be the best one to choose. And it was just doing the math. You took your premium, and like I said, well, that was a higher number, and it might look a little scarier when you're looking at these, but when you do the math, you can see it's almost a $2,000 difference, just by maybe paying a little bit more monthly. Okay, so prescription benefits and drug tiers. Formulary list, this is a list of prescriptions, or drugs, I'm sorry, that are covered by your insurance plan. It's a list of, they've got generics, name brands, and they all are in tiers. Typically, your tier 1 through 3 is going to be just a copay. So you may have just a $10 copay, $20 copay, whatever it may be. Tier 4, these are going to be your brand name drugs. These are maybe drugs that are newer on the market, specialty pharmacy. Cancer medications do fall into this category. And with that, they usually don't do a copay, they'll go by coinsurance. So you may have a 10%, 20% responsibility on the cost of that medication. Okay, it is important to review your coverages yearly. So with all these insurance options, renewal time is the best time to consider what's working for you and what's not. Look at your plans, see what's being covered. If there's things that aren't covered this year, that maybe you can anticipate for next year, you know, a medication you might be on, or something might be changing. It's time to look at those. If you know you might need more care, or, you know, you're going into another course of treatment, you know, best to look at the benefits. Make sure your providers are in your network. That is huge. The cost can save you tremendously. Some insurance plans do not have out-of-network benefits, which means you're going to be, either you will be paying full cost for your care or at a higher rate if you do have it out of network. Keeping the providers in your network, like I said, it's a lower cost. If you go out of network, they could potentially charge you, you know, where it may be covered 100%. If you stay in the network, that benefit then changes to maybe 70% coverage, leaving you a huge responsibility. So it's something to keep in mind. Consider your monthly premium costs and your out of pocket. Can you afford this plan? Even if you're looking at the marketplace plans, is that something that you can afford monthly? You need to be realistic. Look for extra benefits that may be available in a plan. Okay, and be aware of the deadlines. All right, so it is so important. When to enroll? All right, Medicaid, anytime. So if you are lacking coverage or for whatever reason, you can get online and apply. New Jersey Family Care, any of the, I have them listed at the end. So Medicare is between October 15th and December 7th. Employers, they like to do their enrollments in the fall and get ready for the new year. So employer-driven plans do begin January 1 as well. So everyone's, I know here, they're already letting us know, you know, it's time for open enrollments coming. It'll be here before you know it, and it will be. Marketplace enrollment, there are special enrollment periods, but I did want to put on here November 1st to December 15th is the actual open enrollment dates for the marketplace. Okay. All right, so tips for medical bills. Keep records, billing statements, explanation of benefits, approvals, denials. Keep all of that with you. And like I said, make sure they match. Make sure, the numbers are looking right. Make sure you're not getting a bill for $5,000 and your out of pocket's only $2. Something is wrong. You have to look. Why didn't they pay? Know your benefits. Know maybe that you only have to pay a copay. And if you're not sure, there's people like me to help, that can certainly give your insurance a call, know the right questions to ask, and see how we can help. Communicate with your providers. This is huge. Make sure you contact your doctor's office. It may have been something as simple as a billing error, a simple diagnosis code, maybe something off by, a point, a letter, a number, an honest mistake, but, something certainly that can be cleared up just by calling your doctor and letting them know, and they can look into it and take care of that for you. Denials for treatment. All right, keep calm. Easier said than done, I know. But you have to know, at least I can speak from my experience here, that 9 times out of 10, an appeal is already being done by the time you've received that notification in the mail. We've got somebody checking real time to see if insurance is maybe pending an approval, what's going on, what do they need? Do they need some more supporting documentation from our physicians? And they are all willing to do that. If for some reason this is still denied, if a test or plan of treatment is still denied, our physicians will then get a peer-to-peer set up so our medical doctors will speak with their medical doctors. We present the case and explain to them, this is why we feel this is the best course of treatment. Our doctors have everything to back it up, and then, the conversation's had, and then a decision is made from there. If it's still denied, there is still hope. And I've not seen any of these yet, but external appeals. And that's done by a third party where they would come in, they take a look at the insurance, they take a look at the coverage availability, the reasons the physician, was pushing for this particular treatment, the supporting documentation behind it. Getting help with medical bills. If you get a medical bill and you are unable to pay, it is so important not to ignore it. Please call your doctor, call your provider. First, see if maybe they can give you some more time. See if they'd be willing to negotiate a payment plan or accept a lower lump sum. You'd be surprised what is available to you. You just have to ask. So copay assistance programs, these are some of my favorites. And this can alleviate a lot of the financial burden of a cancer diagnosis just by giving these folks a call. There's a couple that I do recommend. Cancer Care is fantastic, and Patient Advocate. Both of those, I recommend our patients just call them, see what is available for them to help you with. They can help with copays. They can help with transportation. I've even had a gentleman help get his dog walked. They literally think of everything. They just want to make sure there are no barriers to care, that our patients are able to come get their treatments that they need and go home with some peace and not have to worry about the burden of bills. Charity Care, that's another program. That's a program here we have at the hospital. I'm in New Jersey, they're statewide. And this is a program that can potentially help alleviate some of those balances from your insurance. Some folks have it come in as a secondary or acts as a secondary, and they're covering about they will cover 20% to 100% of your balance after your insurance pays. So your plan will pay what they're going to pay. If you do qualify for a charity care program, the constraints are a little less than Medicaid, so you've got you can have more income, I guess is the best word, to qualify. It is income based, but then again, you may be eligible. You'd be surprised, maybe for 50% off of a bill. It does not hurt to do the application, and if that fails, there are other opportunities. Providers do have financial assistance programs. I know we have one here at Capitol Health. It's available to everybody. You just have to fill out the application. All right, replacing lost wages. So just a couple quick things here. While with having a cancer diagnosis, you may not be able to work full time. You may have to take time off for a surgery or a specific treatment or whatever the case may be. So just a couple things with disability insurance, short-term, long-term. State disability, short-term is available here in New Jersey. Federal long-term, so there's Social Security disability insurance, and that goes on your work history. And then there's supplemental security income. And this is for lower income folks. All right, let's see. And so Cobra, I didn't touch on Cobra. It is a very big topic. But so a couple things I just want to talk about. The American Rescue Plan of 2021. This came about along with the coronavirus relief package. With this, in this plan, there is a Cobra continuation coverage. So you can get your premiums covered 100% up until September 30th of 2021. So it began April 1st and it runs through September 30th. And your employer it's just as simple as going online. There's a form to be completed with your employer. And then they are intern paid, but they pay your premiums. So you are not responsible for your insurance premiums during this time frame. This is huge. I know this provides a lot of relief for patients, especially that may have had their job time reduced or working less hours. All right, additional resources. So community programs, they are out there. I work daily with groups and I'm reminded of the kindness every day. People just raise money. They just want to help. They don't care how rich or poor you are. They just know that you have a cancer diagnosis and they want to help you. There's groups that will help pay your electric. They'll pay your cell phone bill. It's just a matter of connecting to them, finding folks that are local to you that are willing to help or able to help. See, there's LIHEAP, that, heating, that kind of assistance. SNAP for food, social services is great for, it's a wealth of information. That would be your best bet for Medicare, Medicaid services, local food banks, and of course your Capitol Health Cancer Center. Your entire team here is willing to work around the clock to help you in any way we can. We've got New Jersey SHIP, that was the one I discussed, that will help you with your Medicare, getting started on Medicare. Medicare.gov is fantastic. They've got a bunch of tutorials and just they break down everything, very easy to understand. New Jersey Family Care, Cancer Care, Patient Advocate. Like I said, those are ones that would be able to help with those copay assistance and different program opportunities. Needy Meds and HealthWell, those are ones that can help you with prescriptions. Sometimes there's either through these folks, they can maybe get you a discounted rate on prescriptions. And it's just a matter of getting online to check them out. And also manufacturers' coupons, those kind of things. Manufacturers also have a bunch of programs that they may be able to get you in where you wouldn't have to pay for medications, that they would be covered. Okay. All right. Thank you very much. And it's back to Christian.
All right. So now we want to transition into, well, what can I do, right? We gave you a practical overview of what cancer is. We gave you a practical introduction to the different members of your multidisciplinary team who would provide that care. Well, what about me? I think a common theme that I hear is I feel like I don't have control anymore because I come here and all I'm being told is do this, do this, do that. And I just feel like I'm just waiting for someone else to come and hit me. Well, there are some things that you can do, right? To be proactive in being the center of your care. Your care will be, you will be in the center of your care as much as you allow yourself to be. So with that in mind, like going into any new class, any new situation, you're gonna learn a lot of new things. So be ready to take in that information, whether you're a type A or not. I think it's always, I think one of the best suggestions I can give you is bring something with you to write down, right? Bring a notebook, because you know what? In the middle of it, as a doctor's telling you all these different things, it's gonna go into one ear and go out the other. But when you write it down, when you go home, when you have that cup of tea or a cup of coffee just to settle, then you could take time to read what was told to you and then be able to formulate better questions. But even before that, before you go in, be ready to ask some particular questions that's important to you, okay? Some of those questions could be, what type of cancer do I have? Has it spread to other areas of my body? Would a clinical trial be right for me? What are the possible side effects of treatment? How will we know if the treatment is working? And so on and so forth, right? So and every time you meet with a doctor, right, in regards to the type of treatment you're receiving or what kind of doctor the doctor is, or even with the nurse, keep asking the questions, get the answer, take some time to process it, and then ask again. And the beauty of this process is, again, those two words, nurse navigator. They're the ones that will hold your hand. They have the medical knowledge and the specific and close relationship with the doctors, as well as everyone else that's in your team. That is why they're there. And we use them well, and they are wonderful. So, even if, okay, what kind of questions should I be asking? Even something of that. Build that relationship so that you could have a good conduit of information that's coming. For one, the quantity information, but then also have the ability to absorb that information as well. In the beginning, we talked about the Odysseus, right? And then the takeaway from the story was, yes, the knowledge, but two, the important thing about Odysseus was what? That he had people helping him. No matter how smart, how adventurous, how unique Odysseus was as a hero, he would not be who he is with the people around him. And it's the same thing with your treatment. It's the same thing with your multidisciplinary team that I introduced, but it is also the same with your support team, your family, your friends, your community group, your faith organization, right? It is so important to build your support team. And just like Odysseus, as you begin and as your loved one begins this cancer journey, it is so important to build that support. Not just, let's just gather the people that I like and kind of just let them do what they do, but to be specific in what they can do for you. One of the most important things I think that many people become afraid of is the living will or the advanced directive, right? This has a direct parallel with what Odysseus did, right? Odysseus, before he lost his mind, before he lost his ability to decide, he made decisions and told people about it, right? And that's exactly what advanced directive is. Before you, for whatever reason, lose your ability to make a decision, an advanced directive is a document that we create together in a healthcare setting so that we can provide the care that you want, even if you may not be able to verbalize it to us directly. Right? So speak with your family and let them know what your wishes are. Meet with us, let us know. Let's get that advanced directive on your chart so that we know from the get-go, this is what I want. And then of course, as with choices, they change, your preferences change too. And advanced directives can be changed at a later time as well. In particular to your team as well, who can help. It's really good to itemize and categorize the types of support that you're going to need, right? Particularly even physical support. If you are in a later stage of your life, depending on the types of treatment you receive, you may lose some physical mobility, depending on the side effects and the impact of some of the treatments. You may feel more groggy. You may need some more support. So even the practical thing of who is strong enough to carry me, help me get into my car, who is able to maybe even drive me to my appointments later on, to pick someone for that, emotional support, right? Sometimes even speaking, it's really nice to speak with professionals and to have that confidentiality, but it's also really good to have someone where if they see your eyes, they know what you're thinking, and when you see their eyes, you know what they're feeling. That's really important. And sometimes, with relationships, we have this tendency of, especially people are close, oh, they'll just know and we'll just know. And that's true. But it's really good from the get-go to say, hey, I'm trying to build my support team as I go through this cancer stuff. Can I rely on you to call you when I just need that emotional support? That poem that really picks me up? When I call you and when I say, hey, I think I need some help, can you read me that poem? Do you notice what I did there? Where it wasn't just, you know what, I just need some emotional help. It wasn't a general ask, it was specific, right? So again, when you have your full faculties with you, when you know that there's a journey ahead, what are the specific things that you need? Ask them now so that they can deliver, even if you don't know how to ask later on. There's also simple things with simple responsibilities and tasks, from doing the laundry, mowing the lawn, paying your bills, right? Take the time to delegate those responsibilities. Especially, I know spouses, we want to be the champions for our loved ones, but also you have to be mindful, they're still just one person. They will never say no to you. They will never say no, but you also know them and you know their limits. So for their sake and for yours, take the time to delegate. Okay, and I think one important thing in particular is the communication. Who's gonna be your speakerphone, right? Especially when you have when you're part of a big community or a big family or a big church, so to say, people are gonna be calling you, texting you, are you okay? How are you doing? All this. And just in the beginning to say, hey, I need a PR person. I need someone just to kind of to let people know this is what I'm going through. This is the kind of help I need. Yes, a meal train would be wonderful, but I can't take pasta every day for 3 months, right? To have one person really take care of that portion, so your support system, social circle at large, won't bombard you, and at the same time, they won't feel like they're left in the dark. So again, as you have your multidisciplinary team and we have our specific tasks to carry out what we need to do for your maximum benefit, we sincerely encourage you to do the same with your peer support team. All right. Now, okay, that sounds good, but what can I do now? Right? And it's always, especially, whenever we come with the unknown, there's always that comfort of being able to do something now. Okay, so what can you do now? If you are facing a cancer diagnosis, if your loved one is facing a diagnosis, what are some things that can help me and help them? So this is a good place to start. Do more of these. Exercise, eat healthy, manage stress, and get enough sleep. I'll give you a little backstage pass into whenever I do my own assessments. When I speak with someone, you will commonly hear me ask, how are you eating? Have your eating habits changed lately? Have your sleeping patterns changed lately? And the reason why I ask that is those are a couple of the first things to go when you are under significant stress. And then you know how people say as a joke, oh, stress is a killer. Well, it's true. It's one of the main factors of disease in our country, if not the world, right? So how do you relieve stress? Because stress is so multifactorial and there's so many ways to get stress. One of the easiest ways to relieve stress, even if your mind and you're overwhelmed, exercise. By exercising, going for that brisk walk, cardiovascular, weight training, even whatever you can, getting some fresh air, that naturally allows your stress level to go down. And then, if, from the Dr. Oz's to all the pop medical shows, they talk about eating healthy. There's some truth to that, because what they say, food is your best medicine. So rather than having those processed sugars, rather than eating that comfort food, because emotionally at that time, you think that's going to make you feel better because it feels good going in, but it's not really doing a lot of good for your body. So again, that's one of the reasons we also have the oncology nutritionists, so that by being able to eat healthy, eat a balanced diet, it actually really improves your mood, and it helps your body and gives the energy for your body to fight for the long journey ahead. On the flip side, if you're doing more of this, what can you do less of? Putting things into your body that may not help, or they may, feed the cancer. From the processed sugars, a lot of processed sugars, to the tobacco products, vaping, alcohol, right? And particularly ruminating. Ruminating is a term that we use when we just keep thinking about the same thing over and over and over and over again. And the thing is, in our mind, when we think about something that's negative, Logically, we know that it's a hypothetical situation or we're thinking through things. But you know what? In your mind, in the emotion of it, you're actually living it every single time. That is the feeding ground for depression. That is the feeding ground for anxiety. And especially when you are constantly thinking about something that you do not have that knowledge base for, it is our natural human instinct to think the absolute worst. So think about it. New cancer diagnosis, not a lot of support, not reaching out to a nurse navigator. All you see is cancer, cancer, cancer. All you see is, let me Google this. And then you see all these Facebook posts about this. And that's what I'm saying, to have that right knowledge base and then the right support system to get you out of that hypothetical thinking mode and get into more practical, proactive mode, right? Take the action instead of just thinking those thoughts. As it says in that quote, which I love, life is a balance of holding on and letting go. It is the process of the inhale and the exhale. Inhale that life around you, the love around you, the things that are positive in your life, and exhale the things that are putting you down, the things, those negative thoughts that says nothing will change it. And then you keep breathing and you keep breathing and you breathe that life in, and you'd be surprised where your mindset goes, and you'd be surprised even where your treatment goes. Next, in terms of a more very practical sense, make a RAP plan, which is a wellness and recovery action plan. This is actually used a lot for mental health, particularly for substance abuse. It is literally a very practical treatment plan, so to say, or an action plan to make, so that when you are in it, in that blank, right? When you are in it, you know what to do, right? So particularly for stressors, what are the things that stress you? People, places, and things, right? So during the time where you gain treatment, during the time when you are feeling a little more down, it's good to avoid those things. Don't do your taxes after your doctor tells you you have a cancer diagnosis. That is not a good thing to do, right? And that is a practical, easy choice to make. And even better than that, get someone who's good with numbers on your support team and have them take care of it. Do you see how this works? You see what might be ahead, and then you divide and you conquer, right? Now, particularly with your stressors, you have your early warning signs. Now, what that is the result of what the stressor can be. So for example, for some people, when they're stressed, their shoulder tightens up. When some people, when they're stressed, their breathing gets light. Because the thing is, sometimes we may not know our stressors, but we know our body. So what are some of the things in your body that will give you that red flag, say, wait, something is different, something's going on, what do I need to do? You could start by taking care of the physical symptoms with physical treatments, but also talking to people, talking to your support, and also, especially as you go through your oncology treatments, speaking with your multidisciplinary team. Okay, they know you have a lot of questions. We know that you have a million, and we know that after a while, there's this feeling of, oh, that's just a stupid question. Oh, it should be okay. No, no, no. Let us know. The nurse navigator, myself, the supportive staff, the nurse practitioner, the doctors, they'll let you know what's important to know and what's not. But it's more important for us to know so that we could help and direct your treatment, rather than 3 months later, it's like, yeah, I felt this tightness and it kept getting worse and this pain kept shooting down my back, but I just thought it was just my bed. No, let us know. Because if it warrants further exploration, we will absolutely explore it. And with cancer treatment, and cancer treatment and diagnosis and this process, it is always easier and better when we could do it sooner and faster. Okay? So again, that goes for a third part. Who can I call? Who's your medical oncologist? If you're in radiation treatment, who's your radiation oncologist? Who's my primary doctor? What is the number? Does he have a cell phone that I can call in the evening time? What is the number of what is the number of the medical oncologist office? If the doctor is not there for whatever reason that particular day, who can I speak to? Right? So that's kind of our overview for this introduction, this practical introduction of kind of entering in partnership with us in your cancer journey or in your loved one's cancer journey. And I just wanted to end this time with a story. And the story is about little Timmy and little Johnny. Little Timmy and little Johnny, they're 8 years old and they're in an elementary school in a rural part of town. And you know, back in the day, and I don't know if they do it now, but when I was younger and when you were younger, you would have recess. And then when it would rain, you would have recess inside. They break out the checkers, they break out the chess, the board games, and you would have your fun. Well, little Timmy and little Johnny, it's raining outside, so they're in the classroom and they're playing checkers. And while they're playing checkers, the teacher is in the corner, you know, just making sure that the kids aren't biting each other and doing all those wonderful things. And the teacher's watching little Timmy and little Johnny play. And while little Timmy and little Johnny are playing, Timmy takes out of his bag this really big, juicy looking orange. And Johnny's eyes get wide open and his mouth begins to water. And he says, Timmy, what is that? And Timmy says, it's my orange. And Johnny goes, can I have some? And Timmy's just like, you know, hold on there, buddy, right? And Timmy begins to peel the orange. And as he peels the orange, the juices start to squirt out a little bit. And Johnny is just, eyes are getting wider. His mouth is just opening up a little bit. He is salivating. And Johnny's like, Timmy, can I have some of your orange? And Timmy just peels the orange. And then once he peels it, he takes a big piece and just puts it in his mouth and eats it all. And the teacher sees this and her heart breaks. Because the teacher knows Timmy and the teacher knows Johnny. And the teacher knows that Johnny lives in a trailer park. And the teacher knows that Johnny's parents both work full time and Johnny is home alone a lot and they don't have much. So after school, the teacher goes to the local Five and Dime, the Woolworths, right? And she gets some clothes for Johnny. She gets a fire truck because that's what Johnny loves. And she gets Johnny a big bag of oranges. And she goes to the trailer park. She goes to Johnny's mobile home and knocks on the door. And the teacher knocks and Johnny opens the door and sees through the screen door his teacher. And he is just really confused because, you know, at 8 years old, you think your teacher lives in your school. And Johnny's just kind of tilting his head. What in the world is going on? And the teacher says, Johnny, hey, it's me. Can I come in? I have some things for you. And she shows him the bag. Johnny lets her in. And Johnny, the teacher comes to the table and starts to take the stuff out of the bag. She takes out the shirts and, you know, Johnny's like, whatever. He's 8 years old. He doesn't care about shirts. She takes out the fire truck and Johnny takes it out of her hand, starts playing with it because he loves fire trucks. He presses a little button for the sirens to go off. And then while Johnny's, you know, in the corner, playing with the fire truck, the teacher begins to take out the bag of oranges. And the moment the oranges are out of the bag, Johnny drops the fire truck, runs to the teacher, takes the bag, rips the bag out, and gets the orange. And he takes a bite of the orange. And the teacher goes, no, no, no. And then what Johnny does is takes the orange, then peels the orange, right? Because the teacher said, this is how you do it. Johnny peels the orange. And after he peels the orange, he eats the peel of the orange. And the teacher goes, no, no, no. And the teacher takes a piece of that orange, of that juicy orange, and puts it in Johnny's mouth. And Johnny, for the first time, tastes that juicy orange. And a soft, bright, wonderful smile forms on his face as the juices flow down his mouth. I know so many times, especially when things are hard, I know so many times when especially things look dark and it feels like night is coming, we feel that all we deserve is the peel. We feel that all we deserve is isolation. We feel all we deserve is just to get through it. But we're here to remind you, from our medical team to our supportive staff, that you deserve more than the peel, that you deserve that juicy slice of orange. You are made for more. than what you think you're going through. And we're going to be here with you to make sure and remind you that you are. That concludes our time together. I'm going to ask Allison to come join me, and we will be open for questions. Thank you.
Hi, it's me, Jessica. There's two questions, I believe, in the chat. I'm just going to read one at a time. So the first question is, any reason you did not mention proton therapy and cyber knife therapy?
Sure. One moment. Let me just readjust my
Okay.
screen so that I could see. And then we'll go ahead. Did you say why did we not mention proton therapy and cyberknife, correct?
Yes.
So proton therapy, it isn't for all types of cancers, for one. Two, there are not many proton therapy centers around. It is a very expensive piece of equipment to acquire at this moment. And usually with treatment, as Allison mentioned, with all those numbers, unfortunately, insurers and insurance companies are the ones driving the use. And right now, the majority of insurers deny coverage based on this therapy being experimental or investigational at this time, and possibly even not necessary. The science right now doesn't direct it for one particular specific benefit. And also, there are a lot of lawsuits underway regarding the coverage denial. So with all those factors in mind, I did not include that in the talk, in our talk for today. But again, the important thing is, this is the practical talk. Speak with your medical professional, your doctors, and they'll be able to give you a wider landscape and more specific information to what will be the best treatment for you. Okay, in regards to cyberknife, we do have cyberknife here. We didn't discuss it more in the presentation because, like cyberknife, we have a lot of different radiation therapies, but cyberknife definitely is part of our repertoire or regimen.
Okay. And the second question is, how can someone who has received a cancer diagnosis put others at ease? Some people who could be part of the patient's personal support network seem to shy away as if the cancer is a contagious disease.
Yeah. And I think that's in part because everyone has a journey, right? You as someone who's going through it are in a journey, and the people around you, they're also going on a journey. And it is this weird dynamic that forms and this weird dance that begins of wanting to be that support for someone and not, or even it's the opposite. Fear does weird things to us and to our body and to our minds. So I think one of the important things, like I mentioned at the beginning of the presentation, is knowledge. What does it look like to then sit down with that person, give and speak to them, allow them to ask the questions, allow them to say the things that they want to say or even need to say. And if you can clarify your expectations with the other person, that really helps. But the thing is, when we, out of our own fear or our own anxiety or their fear and their anxiety, when silence builds, that's when things can get rough.
Another question is, should patients always ask their doctors for drugs within their plan? And then this is part two of the same thing, is do they need to remind them each time they get a drug?
So, well, yes, absolutely. Have the conversation with your physician. Like I said, there's tiers involved. There's generic medication options, and there are manufacturer assistance options too. So it's best to talk with your provider to see if there's something they could maybe recommend safely that would be just as effective as the original medication prescribed. And then, like I said, if not, then there may be some opportunity for manufacturer assistance for that particular medication. But so don't take no is the first answer. Let their doctor's office give a call to the insurance, see how they can maybe get this covered at a lesser rate. There are options for that. So it is important to have the conversation with your physician. You don't necessarily have to have it every time. They keep pretty good records. So they should know then what is covered. And like I said, even when going into your benefits for the following year, make sure the prescriptions that you do take are covered in your formulary. And if not, like I said, have the conversation with your provider that they can best get.
Oh.
Yeah. And just to kind of add to that, what your formulary is, every insurance company releases a list of medications that they cover without authorization, and then they also cover with authorization. And the medical staff, depending on which office, they have access to it. So if it's a medication that you need, the doctors will speak with the staff, and we will make sure if it's covered. If it's not, then we will try
medication
those things
assistance, those
Yeah.
kind of things. Absolutely.
And while we have this awkward silence,
Oh,
if you just
sorry, I didn't realize I was on.
no, because I know, Allison mentioned that Medicare itself, it could be a whole nother seminar, and it absolutely is true. And actually, there is another seminar just based on Medicaid. And actually, if you guys can go to the chat, I'm going to add the link right there.
Okay.
So just to kind of let you guys know about what the event is, I'm going to pull it up right now. And actually, you know what? With the power of Zoom,
You can share
I will share the screen.
Yay.
All right.
All
so,
right.
The speaker is Mary McGeary. She is the director of New Jersey State Health Insurance Assistance Program, and she will go through all about your Medicare benefits for 2021. And the event is happening on May 20th between 2 to 3 o'clock via Zoom. So you can register the same way you registered for this seminar.
Highly recommended. Medicare can be tricky and confusing, and these folks are great. I've been to them myself. They really do a good job at explaining the ins and outs of Medicare and helping you get set up with it as well. They've got folks that volunteer just to help guide you through the process. It's a great organization. I highly recommend the presentation.
Okay. And the last question we have in the chat box is, how do you stop ruminating?
Easier said than done, because ruminating happens for a reason, because it's been happening for a while. A simple answer I can give is really learning how to balance between your thoughts and your feelings, because your thoughts are, if your feelings, think of your feelings as a river, your thoughts are the banks. So you have to be able to situate your banks in a particular way to allow your river to flow a certain way. If there are no banks, water will get everywhere. Right? But it takes practice being able to set those banks in a particular way that is most advantageous to you. One of the most important things that you can learn as a skill, something that I help people with here and as well as other psychotherapists, is how to allow yourself and give yourself permission to let go of things at a certain time to enjoy something. Because your stressors, right? As much as we would love, if we let it go for a moment for it to go away, it's not going to go anywhere, right? So what does it look like to kind of let that go and to enjoy yourself in something, and then gain the strength from that so you can continue to move on? It's always that balance between, do I carry do I want a lighter load, or do I want a stronger back? But it's something that takes practice, it takes time, but it is absolutely worth it, not just in this journey, but your life overall.
I just want to say thank you, everyone, for joining us this evening, and also thank you to our presenters for presenting to us this evening. Please don't forget to fill out the survey. The link is in the chat box. If you need help with it, I am going to stay on a couple more minutes to help anyone with questions. And again, thank you, everybody. And thanks, Christian and Allison.
Thank you.
Thank you, Jess.
Have a good night, y'all. Thank you.